I'm Dr. Kirsten Lewanig, and I'm coming to you from River Valley Chiropractic here in Grand Junction, Colorado, where we teach you to move well so that you can live well. And it is the start of fall sports going on in the high schools and just the fall sports season. And with that, we have some patients that are coming in and they're complaining of pain in the front of their leg with their increase in activity. So when they have pain in the front of their leg, what we typically call this is shin splints. You may have heard of these. This is when you have a lot of pain going on the inside of the front of your leg over the shin area. This is usually due to cumulative stress or an overuse of the legs in an activity. The top two causes for shin splints is actually moderate to heavy physical activity, if you're involved in moderate to heavy physical activity, or a sudden increase in your sports activity. So that's where we see it with the fall sports, because you have kids coming from doing nothing or sitting around most of the summer, playing video games, watching TV, and all of a sudden here they are full-blown into fall sports such as cross country or soccer, and they go from no activity to a sudden increase in intense activity 5 to 6 days a week. So some of the symptoms that we see with shin splints include pain in the front, like we talked about, pain on the shin area in the front of the lower leg. That pain typically tends to increase with activity and should be less when they are at rest. And it may be tender and sore to the touch on the front of the lower leg, as well as there may be some mild swelling. So let's talk a little bit about what you can do to treat the shin splints that you're having with your fall sports. This would include RICE, what we call RICE, which is rest, ice, compression, and elevation. So rest typically means taking a break from the activity that's causing the shin splints. Now this isn't always possible. Some of our patients, like I said, they're involved in fall sports and it's not like they can just stop doing the activity. So they can look to do some alternate training on the days when they're not at practice, such as biking or swimming that's not a impact force type exercise. They want to ice the area after activity. And ice, there's different ways you can do that. You can just put an ice pack on them, but personally I like to use an old trick where you freeze some water in a Dixie cup, and then they tear off the top of that Dixie cup, and they can actually massage on the front of their shins with that Dixie cup, the ice in the Dixie cup, and that gets it to be a lot colder in that area and more specific to the area of complaint and where it's hurting for them. Another option is massage. This could be done by the trainer, the coach. It could also be done by a chiropractor, physical therapist. Those type of people can do massage in there where they're actually stripping the area and massaging the sore area. That can be very painful but also very effective. Another treatment would be strengthening and stretching the area. You're going to want to focus on the calf muscles, stretching that out before and after, doing a proper warm-up before the activity and stretching it after the activity, as well as strengthening of those calves with things like calf raises, walking on the heels, and strengthening the hip musculature as well, and stretching all of that out. Additional treatment that we like to offer to our patients is chiropractic care. We provide them with an adjustment. The adjustment's going to keep their spine in proper alignment. That's going to help ensure that the lower extremity, the muscles, and everything is working the way it's supposed to. They have proper mechanics when they're running, when they're involved in their activity. We can also adjust the extremities. We can adjust in the hip, knee, ankle, toe area as well to keep that functioning so that there's not a loss of range of motion going on where they're unable to move their joint, to its maximum limit. And that way we can keep that moving properly to help reduce the shin splints getting worse, as well as help to treat as they're going along. Also here at our chiropractor office, we will provide ultrasound. Now ultrasound is a deep heater. I typically don't use it when they are really acute and they're brand new shin splints, but for shin splints that have been hanging on for a little while, 2-3 weeks, we might do some ultrasound in the area, and that brings healing to the area, helps to decrease the inflammation going on in the front of their leg, as well as prescribe exercises that they can be doing to, again, stretch and strengthen the muscles that are involved to reduce those shin splints. Now let's talk about prevention. So obviously shin splints are not fun, and so if we can avoid them at all, that's what we want to do. So things that you can do, we've already talked about a couple of them. One of those would be proper warm-up before the activity, as well as stretching after the activity. Another one would be making sure you have the proper shoes. If the shoes are not proper and they're broken down, that can lead to an increased incidence of shin splints, as well as gradually increasing the intensity of your exercise. So that would mean instead of going from doing nothing, you would be doing some of your activity over the summer or before your sport or activity is set to begin, and gradually increasing your activity instead of going from, sitting, watching TV, doing nothing to all of a sudden running, 30 to 40 minutes, 6 days a week. So that's a sudden increase in activity. So if we can gradually increase that by starting to exercise 1 or 2 days a week, taking that up to 2 to 3, 3 to 4, 4 to 5, and so on, until you get to that level of intensity that it's going to be when you start your fall activity or your spring activity. So that would be the main ones, would be proper shoes and that gradual increase in activity. Other things, again, we've talked about are the stretching and the strengthening, being involved in a strengthening program where you're strengthening the hips, the calves, the leg musculature, making sure that's all strong, as well as stretching those areas that are tight and making sure that everything is properly moving. And that would be also regular chiropractic adjustments. So by getting your spine properly taken care of on a regular basis, again, you stay in proper alignment, and that ensures that the body mechanics for your entire body, including the lower extremities, is in proper alignment, and that's going to reduce the incidence of shin splints as well. If you have any more questions about shin splints or are looking, any questions that pop up in your head after this video, go ahead and pop them below in the comments, and I will get to them as soon as I can. As well, if you could go ahead and like this video and subscribe to our channel. That would be great. Thank you for joining me today. I look forward to talking to you next time. Have a great day. Bye-bye.